The data collection and analytical process. No known way to prevent irreversible dementia or even many types of reversible dementia exists. When thinking of how to do something, do not think only of how to get the task accomplished. When your loved one does not act the way you want or are used to, it can be frustrating, upsetting, and confusing. A person who is tired is more prone to aggravation, obviously, and so someone getting tired without the sense that it is almost bedtime can become especially confused. As the disease progresses, less and less language is used, until the patient becomes virtually mute. When a person is affected by more than one dementia disorder, the dementia can be referred to as a mixed dementia. People seeking home care nurses and health aides. Assisted living facilities and board and care homes are designed for individuals who have difficulty living alone but do not need daily nursing care. Respite care offers a safe, comfortable place for your loved one while you are away. In-home respite care providers may act as companions for someone who is sick or elderly. The best place to start is to ask your estate lawyer, financial advisor, and even your accountant. You can learn more about non-Medicaid senior care options from your regional agency on aging. 8 care homes will be randomly selected from all care homes who accept the invitation. Mental well-being of older people in care homes. Staff should be alert to the presentation of new symptoms and competent in recognizing when older people need a referral for assessment and management of physical problems. Most people are over 65 when diagnosed, although some younger people have early onset dementia. Trained staff refers to staff who have been trained to recognize and record the symptoms and signs of physical problems when caring for older people. The quality standard defines clinical best practice for dementia and should be read in full. Pain in people with dementia is often poorly recognized and undertreated, and yet it is not difficult to treat. The GP may refer to a consultant who will conduct a full assessment to try to establish the cause of the symptoms. People with care and support needs. Many healthcare providers can consider the risk of sharing a diagnosis of cognitive and/or behavioral impairment with the ALS patient and/or his family. People with dementia are at higher risk of depression, which can make you less active, and affect how well you eat, drink and sleep, leading to an increased risk of falls. The next time you visit your doctor, ask if a clinical trial might be right for you. When you become part of a clinical trial, you will still receive care from your primary doctor for your overall health. Though many conditions may have similar symptoms to dementia, not all are considered to be dementia. Early diagnosis is crucial in tackling the symptoms of dementia that can lead to loss in health, well-being, and a breakdown in positive family relationships. End-of-life care and advanced care planning. An advanced care plan is a way to record your wishes in terms of current and future medical care. In cases of advanced dementia, clear, comprehensive, consistent, and convincing directives, living wills may not by themselves be effective. A great deal of overlap exists in the ways in which palliative care and hospice care are organized and provided, as outlined in the table below. There was nowhere to stand, eat, sleep, or a place to work where you could avoid hearing the labored painful moans of the woman in room 14. Since detecting pain in a person with dementia is not always easy, you might want to opt for a more proactive approach to dealing with possible painful conditions. Persons suffering from severe dementia are no longer able to verbally express themselves, which makes them a vulnerable patient group and dependent on their caregivers. Some unique aspects of end-of-life care. People with vascular dementia may need therapy and support to help them manage day-to-day. As primary caregiver for your loved one with dementia, you know what an overwhelming and time-consuming job it can be. When you are first diagnosed with dementia, your goals may be to preserve your ability to perform your daily activities. Due to their cognitive impairment, seniors with dementia might not be able to provide for their own day-to-day needs. Hallucinations can involve any of the 5 senses a person with dementia may see, hear, smell, taste or feel something that is not there. Geriatric patients may have psychologic, sociologic, and physical changes resulting from aging, and it is often difficult for the aging person to understand and accept the changes that are taking place, to maintain a positive level of functioning for as long as possible, and to compensate for ongoing losses.